Neurotic, stress-related disorder, somatoform disorder and mental health legislations in India. Brain neurotic disorders. Small blue diamond 1. Neurotic disorder, definition. Neurotic disorders are mental health conditions characterized by chronic distress without delusions or hallucinations. Individuals with neurotic disorders are typically aware that their behavior is irrational or exaggerated, intact reality testing, but they are unable to control it. These disorders cause emotional distress, interfere with daily functioning, and are often related to unconscious conflicts, anxiety, and maladaptive coping mechanisms. Small blue diamond types of neurotic disorders. The major types of neurotic disorders include 1. Generalized anxiety disorder, GAD. Definition. GAD is characterized by excessive and uncontrollable worry about various aspects of life such as health, finances, work, or family. The anxiety is persistent, lasting for 6 months or more. Symptoms. Persistent restlessness or feeling on edge. Fatigue. Difficulty concentrating. Irritability. Muscle tension. Sleep disturbances. The worry is disproportionate to the actual threat and hard to control. 2. Panic disorder. Definition. Panic disorder involves recurrent, unexpected panic attacks, sudden episodes of intense fear or discomfort that peak within minutes. Symptoms of a panic attack include rapid heartbeat, palpitations, shortness of breath, chest pain or discomfort, dizziness or lightheadedness, nausea, fear of losing control or dying. Often, the person develops anticipatory anxiety, avoiding situations for fear of another attack. 3. Phobic anxiety disorders, phobias. Definition. Phobic disorders are characterized by intense, irrational fear of specific objects, situations, or activities, leading to avoidance behavior. Types of phobias. Specific phobia, fear of a specific object or situation, e.g., heights, animals, flying. Social phobia, social anxiety disorder. Fear of social situations and being negatively judged or embarrassed. Agoraphobia, fear of being in situations where escape might be difficult, e.g., crowds, open spaces, public transport. Despite recognizing that the fear is excessive, the person feels powerless to control it. 4. Obsessive-compulsive disorder, OCD. Definition. OCD involves the presence of obsessions, intrusive, unwanted thoughts, and/or compulsions, repetitive behaviors or mental acts performed to reduce anxiety. Examples. Obsessions, fear of contamination, unwanted aggressive or sexual thoughts, need for symmetry. Compulsions, washing hands repeatedly, checking locks, counting or repeating words silently. The behaviors are time-consuming and cause significant distress or impairment. Stress-related disorders. Definition. Stress-related disorders are mental health conditions that occur as a direct psychological response to a stressful or traumatic life event. These disorders arise when a person's ability to cope with or adapt to stress becomes overwhelmed, leading to emotional, behavioral, and physical symptoms. They usually follow identifiable events such as accidents, violence, loss, or major life changes. Types of stress-related disorders. 1. Acute stress disorder, ASD. Definition. Acute stress disorder is a short-term psychological reaction to a traumatic event, occurring within 3 days to 1 month after the event. Common causes include natural disasters, accidents, assaults, sudden death of a loved one. Symptoms. Intrusive thoughts, memories, or flashbacks. Dissociation, feeling numb or detached. Sleep disturbances. Hypervigilance, excessive alertness. Avoidance of reminders of the trauma. If symptoms last longer than a month, the diagnosis may be changed to post-traumatic stress disorder, PTSD. 2. Post-traumatic stress disorder, PTSD. Definition. PTSD is a long-term mental health condition that develops following exposure to a traumatic event, with symptoms persisting for more than 1 month and causing significant impairment. Causes. War, violence, abuse. Serious accidents. Terrorist attacks. Witnessing death or serious injury. Symptoms. Re-experiencing the trauma, flashbacks, nightmares. Avoidance of trauma-related stimuli. Negative mood and thoughts, guilt, fear, hopelessness. Hyperarousal, irritability, sleep issues, exaggerated startle response. PTSD can significantly impair personal, social, and occupational functioning. 3. Adjustment disorder. Definition. Adjustment disorder occurs when an individual has difficulty coping with or adjusting to a significant life stressor, such as divorce, relocation, illness, or job loss. Onset. Symptoms begin within 3 months of the stressful event. Symptoms. Depressed mood or anxiety. Tearfulness, hopelessness. Poor concentration. Sleep problems. Social withdrawal. Impaired work or school performance. Unlike other disorders, the symptoms are clearly related to the identifiable stressor and typically resolve once the stressor is removed or the person adjusts to the situation. Somatoform disorder. Definition. Somatoform disorders, now broadly included under somatic symptom and related disorders in DSM-5, are a group of psychological conditions where a person experiences physical symptoms that are not fully explained by any medical condition, substance use, or another mental disorder. These physical complaints cause significant distress or impairment, and although they appear physical, they are rooted in psychological causes. The person is not faking the symptoms, they are real to them. Types of somatoform disorders. 1. Somatization disorder. Definition. Somatization disorder involves multiple, recurrent, and long-lasting physical complaints affecting various parts of the body, starting before age 30 and persisting for several years. Common symptoms include gastrointestinal issues, nausea, bloating, diarrhea. Neurological symptoms, headaches, fainting, paralysis. Sexual symptoms, pain during intercourse, irregular menstruation. Pain in various locations, back, joints, limbs. Features. Medical tests do not reveal any physical cause. The person repeatedly seeks medical treatment, often from many doctors. It leads to significant disruption in personal and social life. 2. Hypochondriasis, illness anxiety disorder. Definition. Hypochondriasis is characterized by excessive worry about having a serious illness, despite medical reassurance and absence of physical disease. Features. Persistent fear of having or developing a disease, e.g., cancer, heart disease. Frequent checking of body for symptoms. Misinterpretation of normal bodily sensations as serious illness. Repeated doctor visits or complete avoidance of medical care. Even when tests are negative, the person remains convinced they are ill and often becomes anxious or depressed about their health. 3. Somatoform pain disorder, now called pain disorder or somatic symptom disorder with predominant pain. Definition. This disorder is characterized by severe and persistent pain in one or more areas of the body, which cannot be fully explained by a medical condition. Features. The pain causes significant distress or impairment in functioning. The onset or intensity of pain is often related to emotional or psychological stress. The individual may frequently seek medical treatment and pain relief, often without success. Pain may be localized, e.g., back pain, joint pain, or diffuse and is not consciously faked or intentionally produced. Child and adolescent mental health problems. Introduction. Mental health in children and adolescents is a critical part of overall development. It influences emotional well-being, learning ability, relationships, and productivity. Mental health issues during these years, if left untreated, may persist into adulthood. Common mental health problems in children and adolescents. Attention deficit/hyperactivity disorder, ADHD. Symptoms, inattention, impulsivity, hyperactivity. Impact, poor academic performance, social issues. Autism spectrum disorder, ASD. Features, difficulties in communication, social interaction, restricted interests. Usually appears before age 3. Anxiety disorders. Types, separation anxiety, social phobia, generalized anxiety. Symptoms, excessive fear, avoidance behavior, physical complaints. Depression. Symptoms, sadness, withdrawal, irritability, poor concentration. Risk of suicide in older adolescents. Conduct disorder/oppositional defiant disorder, ODD. Behavior, aggression, rule-breaking, defiance. May lead to antisocial behaviors if untreated. Learning disabilities, e.g., dyslexia. Affects reading, writing, and/or math skills. Not due to lack of intelligence. Substance use disorders. Increasing concern among adolescents. Leads to academic failure, legal issues, and health risks. Eating disorders, e.g., anorexia nervosa, bulimia. More common in adolescent girls. Involves body image disturbance and unhealthy eating patterns. Promoting mental health in children and adolescents. 1. Early identification and intervention. Regular screening in schools and pediatric clinics. Early support can prevent progression of disorders. 2. Family support and parenting education. Positive parenting reduces behavioral and emotional problems. Involves open communication and emotional support. 3. School-based mental health programs. Life skills education. Anti-bullying campaigns. School counselors and peer support groups. 4. Psychoeducation. Educate children and families about mental health. Break myths and reduce stigma. 5. Community and social support. Safe neighborhoods, recreational facilities, child protection. Youth clubs and NGOs can provide support. 6. Professional services. Child psychologists, psychiatrists, and social workers. Special education for learning disorders. Mental health legislations in India. Mental health legislation ensures that persons with mental illness are treated with dignity, rights, and equality. India has undergone several legal reforms in this area. Mental Health Act, 1987, now repealed. Focused mainly on custodial care of mentally ill persons. Emphasized institutional treatment, not rights-based. Criticized for being outdated and not rights-compliant. Mental Health Care Act, 2017, current law. A progressive, rights-based legislation that replaced the 1987 Act. Key features. Right to mental health care. Every person has the right to access affordable, quality mental health care. Decriminalization of suicide. Attempt to die by suicide is no longer a criminal offense, such persons must be offered care. Advance directive. A person can specify the treatment they wish or do not wish to receive during mental illness. Nominated representative. Allows individuals to choose someone to make treatment decisions on their behalf. Informed consent and least restrictive treatment. Treatment must be based on patient consent and conducted in the least restrictive environment. Mental health review boards. Established to safeguard patients' rights and review involuntary admissions. Mental Health Authority, central and state. Bodies to oversee implementation and regulation of mental health services. Children and adolescents. Special provisions for care and treatment, with respect for dignity and development.
Thank you so much for watching. Don't forget to like, share, and subscribe. See you in next video.